Hey everyone, welcome back to my channel, Nicole's Diary or Nikki's Diary, um, where I'm just basically walking through my breast cancer journey and experience with breast cancer, just in hopes that it inspires someone out there. So today, before I pick up where I left off last time, I kind of just want to talk a little bit about breast cancer symptoms, or let's just say the symptoms that I had with breast cancer. How about that? So for those who don't know, there are various breast cancer symptoms, and not everyone experiences the same one. I might have one or two, you might have four. You know, somebody can have all of them. But we all know that one of the top or most common breast cancer symptoms, let me say, is to feel a lump in your breasts or maybe up underneath your arm. Okay. Some women have a change in shape of their breasts. Some women have a puckering of the nipple, inversing of the nipple, where the nipple turns inward. Some women have swollen breasts, redness around the breast, nipple discharge, crustiness around the breast. Women get swollen lymph nodes, which are underneath your armpit again. Some women have unexplained weight loss. Women have fatigue. I'm pretty sure there's some more out there that I'm probably missing because, guys, like I said, I have brain fog. Brain fog. Chemo brain. And it's a real thing. So I don't know if I mentioned it in my first video, so in case I didn't, chemo brain. Brain fog. Where you literally don't remember something that you know, or you forget what you were in the middle of doing right while you're doing it. It's real. It's real. So, but that's what happens after chemo, not before. It's not a symptom of breast cancer. It is what happens after you've had chemotherapy treatment. All right. I didn't have any pain in my armpit. I didn't have swollen breasts, redness of the breast, nipple discharge, puckering of the nipple, inverse nipple. I had one symptom, ladies, and that was the knot that I felt in my breast. I didn't feel anything under my arm. I did an armpit, check once I felt the knot in my breast. But I never felt anything else but that knot in my breast. So I say all of that to just say, just know what the symptoms are. Make sure that you're doing your monthly self breast exam, and make sure in your monthly self breast exam that you're also doing your monthly armpit. Feel under your arms, ladies. If you feel a knot or something that you've never felt there, a lump, it's a swollen lymph node, most likely. It's something that you do want to have checked out, okay? So, that's it for the symptoms. Let's move on or pick up from where I left off. Now it's time for me to have my first chemotherapy treatment. And right before I had my first treatment, I had to have a flu shot, which I've never had in my entire life. I had to get a pneumonia vaccination, and I believe that was it as far as vaccinations. I was also given, let me back up. I had to take a chemotherapy educational class. This is a class I would recommend for anyone that's diagnosed with any type of cancer. I would also recommend you take somebody with you to the class if they allow it, which most likely they will. And the reason I say that is because the chemotherapy educational class that you take before your first treatment is to inform you of all the things, or basically what to expect. The medications that you're going to be given, the side effects from those medications that you're going to be given, what chemotherapy entails, And I mean, I had an awesome nurse, Chris. Shout out to Chris. She's been a nurse for a very long time. Very knowledgeable. Loved her. Knew what she was talking about. Very helpful throughout my whole entire treatment. So she did the class, and I brought my daughter along with me. Thank God my daughter was there with me, because I was still numb from being diagnosed with breast cancer. So while I'm in this class, and it's just my daughter and myself taking in the class, the video is playing. It's giving all this different information. Chris is going over all this different information. And I hear some of it, but I'm not really comprehending everything. I just want to kind of get through everything, but I'm not taking in everything at this time still. My daughter was taking in everything. Like I said, thank God she was there with me. She paid attention. She wrote stuff down, and I mean, she retains very well anyway, without even writing anything down, but still, she was there. So, like I said, I had the support from the very beginning, thank God. So, also, my daughter and my son also had, because they were going to be around me, my daughter lived with me in the home. My son at that time didn't live with me in the home, but he was back and forth, and he was going to be around, so he also, my daughter and my son both, had to get the same shots I got. They had to get flu shots, which they've never had in their lives either, and they had to get a pneumonia vaccination. Okay. Everybody did all their shots. All right. I was also given a bag of medication before chemo. There was medication that I had to take, which were anti-nausea drugs, to help combat the nausea before the treatment started. The morning of, I had to take some of those nausea medications, and I believe the night before. I will have to double check and go back and look again. But I had to take these anti-nausea medications, and I was so hopeful. I mean, woo! I was so hopeful that I wasn't going to vomit. I wasn't going to get nauseous, because these anti-nausea medications were going to work, and they were going to be giving me things while I was getting my treatment. Like, woo, okay. So I take the medications. I go to my first treatment, which is right before Christmas, 2019. I go to my treatment, and someone accompanied me to my first treatment. I want to say my older brother accompanied me to my first treatment. Like I said, I have brain fog, y'all, but my brother definitely was at my treatment with me. So if it wasn't my first one, it was my second one, but I believe he was at my first treatment. Okay. And we go to our treatment, or maybe my daughter went to my first treatment and my brother went to my second one. I go to treatment, guys. I get there. They take all my vitals, do all the regular normal stuff. I get hooked up. Oh, let me back up. I'm so sorry. I forgot to talk about my port. So before chemo, I had a port placed in my chest, right here, right up underneath the skin. Took about 20 minutes. I went in, they put you to sleep. They placed a port under the skin. So my experience was I was in and out. I didn't have any side effects. There weren't any complications. It didn't hurt. For me, it didn't hurt. I didn't feel anything. So the placement of my port was fine. And first treatment, when they actually hook the needle, so the port is there, and you all know why the port is there, so that every time you go to chemo, they're not injecting you with an IV to administer those drugs to you. So they clean that area right there with the port, and boop, attach the needle. that never really bothered me at all. I'm not afraid of needles, and this is not like, oh yeah, I'm so strong, I'm not afraid of needles. No, I'm just not afraid of needles. I just like to get it done and over with, you know. I'm not really never worried about if a needle is going to hurt. Not most of the time. It has to be something very, I don't know, scary for me, I guess. So anyway, after they did that, you know, I learned a lot with this experience. I thought I was going to come to chemo. They were going to hook me up, put the needle in where the port is, hook the drugs up, done. I didn't know that I have to wait for my medication to basically be put together in the lab. They're making up the medication. They're getting it together. Chemo drugs are very expensive, so it's not something they do ahead of time. So while I was waiting, the nurse is showing me the refrigerator that has a little snacks and stuff that you're allowed to have while you're there at chemo, because I was going to be there for a while. I was going to be there for hours. I had 2 different medications in the beginning. So I definitely had the Red Devil, guys. And we all know what the Red Devil is. And 2 other different medications. Like I said, I need to go back and look and see all of the chemo drugs that I was given. This is a perfect example. And I'm being so honest with you all that I know the medications when I hear them, carboplatin. I can't tell you everything off the top of my head because I was in a fog, ladies, through my entire treatment. All I wanted to know was that, what was the next step? Is it okay? What do I need to do here? Da-da-da. I don't remember everything off the top of my head like other people do. But I will get the names of those drugs for you all. But like I said, definitely was administered the Red Devil. And we all know why it's called the Red Devil. It looks like syrup, and it's the devil. It's the drug that causes the hair loss, you know. So anyway, I'm waiting for my medication to be administered, and like I said, the nurse is showing me the refrigerator, has all the great snacks, where the bathroom is, da-da-da. If I need to go, I need to take my pole with me because, you know, the IV is hooked up still to you. So here comes the first chemo drug, and pop, they hook it up, and I'm good to go. Leave that. It's very cold in chemo. I would advise anybody that's having chemotherapy treatments to bring along a blanket. Once your hair starts falling out, ladies, bring hats with you. When my hair started to fall out, I wore scarves. So hats, scarves, whatever you want to do. My head wasn't ever cold, but the chemo area, while you're having your treatment, it is cold. So having a blanket was always great. They have heated blankets, which, oh God. So I never had to bring a blanket with me. They always had heated blankets for me, which was awesome. I made sure I kept, like, I would want to take my shoes off and put them to the side. So I made sure I had my little fuzzy socks on to keep my feet warm or whatever. And I have to say, first treatment, straight off the bat, I felt fine during the treatment. The first drug was done. The second bag came. They administered the second one. I was fine. I did have to use the bathroom twice while I was there. I used the bathroom. And then before I left, there was another drug that was placed in like a needle on my stomach, okay? Once again, guys, I don't remember the name of it. But I'm going to pull my medical files just so that I can tell you the name of that. And it can affect your bones once the drug is administered. Like the side effect is your bones hurt. And I got nauseous off of it also, okay? And I say that ahead of time because I don't remember them telling me that was a side effect of that. That offsets the chemo drugs that they give you, that needle, okay? It does not shoot the drug. So it's a catheter, and it's like a little, I don't even know what to call it, you guys, but it's like no bigger than this, really. okay, square. And they stick it on your stomach, and a couple of hours after your treatment, a catheter shoots, basically the needle's in the catheter, so it shoots. You feel the little prickling on your stomach, and it's administering that drug. I felt fine after my treatment. I went home. I laid down. I ate a little something. Still felt fine. I don't quite remember. About 2-3 hours, maybe 3 hours passed by. Trying to remember time. Oh yeah, about 3 hours, and all of a sudden I felt ding on my stomach. It didn't even hurt. It was just like, you know it, like you felt it, and I'm like, uh-oh. So it didn't hurt, but I was scared because I'm like, I hope my bones don't hurt. I don't want any serious side effects. Like right now I'm feeling okay, and I want it to remain like that, please. So I was just, trying to relax and watch some TV, stay hydrated, because that's really important while you're having these treatments. I was trying to, stay hydrated. And all of a sudden, about 30 minutes after that, I just started to get nauseous, you guys. And when I tell you all, I know my body so well. Like I told you all, I knew I was going to get nauseous, and I knew I would start vomiting, and I knew I was going to get sick. And I knew it was going to be the kind of sickness that other people don't get sick. Other people don't experience that. Just like when you're pregnant and have a baby. Through all of my pregnancies, I have severe cases of hyperemesis. Okay, I get severely nauseous, and I severely regurgitate a lot. Okay. So I was sick, and I just started throwing up, and I couldn't stop. And I mean, it was bad. It was bad, okay? I went to the hospital because it was so bad. I called the doctor's office, and they told me to go to the hospital. I went to the hospital because I couldn't stop vomiting. And I knew that I was probably dehydrated and needed to be rehydrated, and trying to do it at home wasn't going to work. So I went to the hospital and got rehydrated. Still felt bad. Once I start to vomit, it takes a long time for my body to get regulated back again, for me to feel normal again. And so I was sick. And I couldn't stop throwing up. And so it went on for a couple of more days. By the time I started feeling better again, y'all, it was time for my next chemo appointment the following week. Like 2 days before that, I started feeling a little bit better. I wasn't as nauseous anymore. I was able to keep some, certain foods down or whatever. Okay, fine. Now it's on to the second chemo appointment. And I'm like, not excited about this. But, hopefully, maybe it'll be different the second time around. Second treatment comes. My brother accompanies me to this treatment. We're all good. And I'm home. Everything is fine. I'm nauseous right after that medicine. Bloop, hits the stomach again. start getting sick, start getting sick, start getting sick. So I'm like, so this is going to be the pattern. Now I know this is going to be my pattern all the time, all the time. Now I see what I'm going to have to go through. So I alert my oncologist about this. And I'm like, every time, like, is there not something that we can do, you know, da-da-da. And so we try, you know, some more anti-nausea drugs. And I'm like, I know these drugs are not going to work. And I know doctors want to try a lot of the time because they're doctors. And their medical books tell them that these drugs are going to work. But I'm telling them that those drugs are not going to work with this body here. Because I've been through the nausea stuff, experience before. This type of nausea. And when I vomit like this, nothing is working. Nothing. Not Zofran, not promethazine. Nothing is working. Not Reglan. None of those drugs are going to work. I don't want any of it. And so my oncologist, he listened to me. He was like, okay, all right. So what I wound up doing was getting some medical marijuana. And that helped a lot with the nausea. It helped a lot with the nausea. But not completely. But it helped a lot. Let me just say that. And so now, this is, like I said, second treatment, and I'm sick as a dog again, like sick. And I believe my brother had to go home. Days had passed, you know, and my brother left, and he went back home for a while. And at this point, that these days had passed, you know, and he's leaving to go home, I'm stronger. You know, the nausea thing has passed again, and I'm all right. And so he's home. So now, third chemo appointment, and I go to chemo, and I'm fine, and I come home, and my daughter had gotten sick. So she wasn't here in the house with me, okay? I think she got the flu. So she went and stayed a couple of blocks away from me at my sister's house. Because she couldn't be around me. So my son came to stay, and his girlfriend at the time was here with him. And I had my treatment. I don't know if it was that day, but it was that week. I had my treatment, and he was here in the house with me. And I was here in my room. I think I had just came home from having my treatment that day. And I was here in the house and got real nauseous. And I was here in my room, laying on the bed. And you guys, all of a sudden, I felt it. And it felt better to lay with no clothes on, okay? Because I was hot and I was nauseous. And if any of you know that extreme nausea feeling, and it's too hot, and you feel like you can't get enough air, and I feel like I couldn't get enough air, so I'm laying I'm in my bed, you know, in my room, in my house, I'm laying down, so I have no clothes on. But the nausea was so bad that I could feel it was going to be a lot. So as it was approaching to come up into my throat, right when it hit, I decided, you know, I'm going to hold it because I want to get out the bed, and I don't want it in my bed. That was the worst mistake I ever could have made. I should have just let it go in my bed. So what? It was in my bed. So what? You can clean that up. Let me tell you what happened to me, because I decided I don't want to make a mess in the bed. I'm going to hold this vomit in my mouth and try to get to the damn toilet and let it out. I aspirated, you guys. Well, how about this? The vomit aspirated back into my lungs. So it went back, instead of continuing to come out, it went back down into my lungs, and I started to choke. And some people say, oh, I was choking, and they're coughing, and they're actually getting air to their lungs. I was choking to death in my house. I couldn't get any air to my lungs. I couldn't cough. I couldn't yell out. I couldn't do anything. I panicked. And in me panicking, I continued to, that's all I could do. Over and over and over and over. While I was doing that, I was moving. I got off the bed. I opened up my bedroom door. And I made it to the hallway. My son and his girlfriend are out in the living room. Remind you guys, I'm butt naked. Okay? I don't care that I'm butt naked. I don't care if they see me butt naked. I need them to help me because I'm dying. So when I get into the hallway, I get down into a fetal position so that they're not able to see my complete body while I am continuing to, I mean, this is like a nightmare. It was a nightmare. This was like a horror movie. You hear me? While I'm doing all of this, I'm banging on the wall because I knew if they hear me banging on the wall, they're going to come and see. My son jumped up, ran into the hallway. His girlfriend running behind me. First thing he sees, he knows I don't have clothes on. He can't really see nothing, but he just knows I don't have any clothes on. And because I was continuing to do that to try to get air to my lungs, by the time he got to me, I didn't realize it. Blood was coming up. So I was starting to breathe. And he screamed out and asked his girlfriend to help me because I didn't have clothes on. So by the time she helped me to the bathroom is when I found out that there was blood coming out my mouth. It was blood coming out my nose. I didn't think at the time, oh, I could have possibly scratched my esophagus. You know, I don't know. Blood's coming out my nose. I didn't think. I was nervous. So they called 911. And when the EMTs got here, they said that it was not an emergency and they didn't think they needed to take me to the hospital. Now, I was so sick, I didn't even fight that, okay, at the time. And the hospital that they would have taken me to, I didn't really want to go to. So that might be one of the reasons I didn't fight it. I was okay. I was breathing. They did look at me, but you know what? I was like, I'm good. I'm fine. What I'm going to do is go to the hospital myself. So the next day, I went to the hospital. And I wound up being admitted into the hospital. Okay. I did wind up scratching and damaging a little bit. So that's where the, you know, blood was coming from out my mouth. The blood was coming out my nose. And that was a very scary experience because I literally almost died in my house after having a chemo treatment. I'm like, damn, the cancer's already trying to kill me, and then here I go, I can't even get a treatment because I'm almost dying from the damn treatment. And I have to say that for years I would always hear that cancer don't hurt you, it's the treatment that hurts. And they have never lied. That is the bold-faced truth. You hear me? Because when you think about it, I wasn't hurting. Yes, the lump was sore that I found in my breast, but it was sore to the touch. It wasn't sore just me sitting around talking or me moving around, me working, me flailing my arms, you know, anything like that. Me just being me. It didn't hurt. It hurt to the touch. Okay? And even going through my chemo treatment, the vomiting is what was hurting me. You know, that's what was doing it for me right there. So that was a scary, scary, scary experience. I hope nobody ever has to experience anything like that. But, you know, the hospital admitted me. And when they did admit me, guys, they also put me on a droplet precautions. And my oncologist was upset because he was like, why are you on a droplet precautions? He asked them, why do you have her on a droplet precautions? She's not contagious. She has blood coming out her nose and her throat because she scratched her esophagus. You guys know that. You know she... Okay, he was like, do me a favor, Nicole. I can see that what you were telling me in the beginning before your treatment about you when you get nauseous, you know, your experience and what it was going to be like for you, and that this is going to be an extreme case of nausea. And, you know, once you vomited, everything you explained to me, he said, it's not that I didn't believe you, but I see it. He said, and I know this has got to be causing you anxiety every time you come to a chemo treatment. So I am going to prescribe something for anxiety. He said, and also, after your treatments, if you keep experiencing this nausea like this extreme nausea and vomiting, don't come to the hospital. Call my office and come to the office. I'll rehydrate you in my office. You shouldn't have to go through all of this. And this is why I say I had an awesome team, because he listened to what I said. It wasn't, oh, you're exaggerating, you know, you're making too much. No, he listened, he saw, he's like, you shouldn't have to do this. You come over here to my office, and I'm going to treat you in my office. I will rehydrate you myself. You can lay up in one of the chairs. I will hook you up to an IV, and I'll get you hydrated and get you feeling better yourself. He said, that was the point of me starting this center, this cancer center here in this hospital at this particular location. He said, there are too many black women that have this disease, and it's not even your disease. It's my people's disease, he said, to be honest with you. And he's right. It really is. Yes, you know, we have the BRCA1 gene. Those of us that carry the gene, you know, those of us that have had breast cancer and have the gene, that BRCA1 gene is not a joke. But like he said, it's not even our meaning black women. It is not a disease. Even though a lot of us get it, it's not ours. How about that? You know, so he's an awesome doctor. I say was because he's no longer my oncologist, only because he, you know, moved on from the practice. But he's an awesome doctor. Yeah, that's all I have to say about that. But that was a scary experience for me, guys. And advocate for yourself. Advocate for yourself if you don't do anything else, because it is so important. And I'll tell you, I advocated for myself throughout my entire treatment. I advocate for myself all the time when it comes to my health, if nothing else, you know. So it's important. Like I said, guys, listen to your body, pay attention to your body, because as they say, your health is your wealth. So until next time, have a good weekend. All right? Thank you for joining and subscribing. Ooh, don't forget to hit the subscribe button, guys. The like button, the share button. To Nicole's Diary.